So, if extinction isn't the answer, what is? Let's take a look at some alternatives that are rooted in compassion and skill building. Hi, I'm Dr. Megan, and I guide people in growing, learning, and cultivating connection and curiosity. And today, we're going to dive in on the last issue relating to extinction, and that is that there are alternatives. We don't need to rely on extinction. So it doesn't make sense that we still are. Why so many practices still rely heavily on full extinction-based procedures when there's clear research to show we don't need to. The most researched alternative is differential reinforcement. There are plenty of studies to show that differential reinforcement is effective without having a full extinction component. There's multiple literature reviews that have demonstrated differential reinforcement in and of itself is sufficient. You don't need to have extinction involved. And in the couple of studies that have indicated they still moved into extinction-based procedures, they weren't incorporating some of the strategies that I would recommend as a clinician with 20 years experience in the field. They just went straight from differential reinforcement to incorporating extinction. I haven't used full-on extinction procedures since 2010, so that's 14 years. And in that time, what I have realized is we need to incorporate the 3 steps to compassion. The 3 steps to compassion are to be comprehensive, to focus on the big 4 preventative measures, which are making sure we're building skills around gaining attention and affection, building leisure skills, building communication, and teaching clients how to navigate adversity. And this is an article from Ala Rosales in 2018 from Behavior Analysis and Practice. Of course, many people nowadays are familiar with the work of Hanley and colleagues on practical functional assessment and skills-based treatment. So that is an obvious research-based strategy that you can use. For me personally, when I've looked at the work being done in that area, especially by clinicians, I've found that more guidance is needed in terms of the initial skill building and assessment process, which is why I created the trauma-informed ascent-based mastery kit for addressing escape behavior. The mastery kit includes assessment, programming, and implementation checklists for the various different areas we need to make sure we're addressing in order to build safe responding for our clients. Those areas are developing connected and trusted relationships, focusing on emotional regulation, looking at the big 4, as I already mentioned, addressing executive functioning skills, then finally diving in on functional assessment, and woven into all of that, looking at environmental supports. By focusing on building skills in these areas, we can teach our clients how to self-advocate in low-stress learning environments and engage in safer responding to communicate and get their needs and wants met. I hope this information has been helpful. Obviously, in a TikTok video or reel, I can't go into all of the details about how we would implement these procedures, but if this information is of interest to you and you would like to learn more, comment GROW and make sure to give me a follow as I continue to dive in on this topic and more around how we can do better in our field as clinicians.